Hi, my name is Amy Kosick. I am very excited to be in this class. I am nearing the end of my master's degree track, and this is an area of healthcare that I really love and I'm really excited to work in. My introduction to quality was when I got involved in infection prevention, which is where I work now. The hospital that I originally started working in infection prevention at was smaller, so infection prevention and quality and patient safety and risk were all very tightly knitted together. So I have quite a bit of experience in quality, and it is something that I'm very passionate about and I'm very excited to learn more about. So a patient safety issue that I was actually personally involved in that I will never forget was when I was a clinical nurse on a med-surg floor. I was maybe a year after graduation, so I was a brand new nurse, and I was in charge. I was the charge nurse for the floor for the night because I was the most senior nurse on the floor that night. And we had a call out, so we were one nurse short and we did not get any extra help for the night. So we had, I think, a 30-bed floor, and we started off with 6 patients each, which was pretty standard for us at the time. But then the admissions started coming, and I kept saying, we're not safe, we need help, or we can't take these admissions because it's just not safe. And I was told, you have to take them, they're coming. So by the end of the night, the other 2 nurses had 9 patients. I had 11 because they were very, very overwhelmed, and I just kept taking the patients because they were getting too overwhelmed and couldn't handle it. So I was taking the extras. So I had 11 patients and they had 9. And I had a surgical patient that ended up having a complication. She was a fresh post-op, and I did not get to her in a good amount of time. I think it was over an hour before I got to her because all of my call lights were on and I just was unable to prioritize. So that's something that I'll never forget. It's part of the reason why I left clinical nursing, but it's also something that I remember when I am working on initiatives for the clinical nurses in the hospital now, and I try to make sure that we're not asking too much of them and that they are always practicing in a safe manner. So I think quality and risk and patient safety are all very closely related, but there are some differences. I think quality focuses on the quality of clinical care. Risk focuses on litigation and legal issues, and patient safety is patient safety. So there are a lot of overlaps, but there are also a lot of differences as well. So on the website, I saw that there was a clinical example of pharmacist-led medication interventions, and it reminded me of when we had a clinical pharmacist attend interdisciplinary rounds in the ICU. And the pharmacist would actually review every medication that the patient was on. And when the physician and the nurse were both there, the pharmacist would go over the medications and say, like, hey, this antibiotic is inappropriate according to the susceptibilities. I recommend this one. Or he would say, the patient is on this at home and I checked their records. Can we order this? Or something along those lines. But every day he had medication suggestions about patients in the ICU, and the patients ended up with better medication management because of it, because there was one person just focusing on medication. So I agree with it. I think it's something that's very beneficial, can be cost effective, and it can also be the best thing for the patients. So interesting facts about me. I'm a mom. I have a 2.5-year-old that is going through the terrible twos, which is a lot of fun. And she's going to be 5 months old tomorrow, my baby. I have 2 dogs, and my husband and we live in Reading, Pennsylvania. Um, and it's a lot of fun. I am very much looking forward to being finished with my master's program, but at the same time, I also don't know what I'm going to do with all my extra time. So after listening to Dr. Berwick speak, this is actually a speech that I have listened to previously, and I really enjoy his story about Isaiah. I think he points out how important it is that we need to understand the lifestyles of our patients and what their socioeconomic status does to their health care. Like, you can provide all of your patients with the best care possible, and you can give the same care to every patient, but they're going to have different outcomes because there are things that they need to take care of at home that can affect their overall health. And those are things that we have to remember about our patients. And that's why holistic care is so important, because we have to care for the whole patient and not just their diagnosis. And that's something that I will always remember about Dr. Berwick's speeches. And I think that that's something that he thinks is very important. And I agree. So a quote that I always keep in mind, and I use for my own personal growth, is from Anthony D'Angelo. And he says, "Become addicted to never-ending self-improvement." I think that's important for individuals, and it's important for organizations too. Is you never want to say, like, I'm as good as I'm going to get, and settle into it, because there's always something to improve. And I say that works for organizations as well, because I think about, like, in an organization, let's say you have a process that needs to be worked on, and you work on it and you make it great, and things are going great, but then you go and look at it 2 years later and everything is screwed up and you don't know why. That's because you always need to be looking at this process and trying to find ways to improve it. Maybe you don't, maybe you do, but you can't just say, it's good now, let's move on, because that's when things fall apart. Like, there's always change, especially in healthcare, there's always things changing, and there's always things that can be improved upon. So you always need to be looking at that, and the same goes for people. So thank you. I look forward to working with all of you.